So CONNECT-HF is a quality improvement trial. We're trying to test different strategies to try to improve the care of patients who are hospitalized with acute heart failure. You know, in the United States right now, there's really a hyper focus on trying to reduce 30-day readmissions. And CONNECT-HF is really focused on more of the care that the patients receive for the next year after they're in the hospital. We're enrolling patients now. We've enrolled a little over 700 patients, and we're on our way. It's a really exciting time, and we're really pleased with how the study's gone so far. So one of the things is we're meeting with hospitals around the country and learning what they're doing to try to reduce readmission rates and improve the care of patients at their hospital. So some of those hospitals are being randomized to an intervention where we're capturing their data, providing a lot of feedback, and then remeasuring to see how they're doing with the care they're providing. And that's really the biggest intervention and where we hope to make an impact here. We also have some really important sub-studies though. One is around using different apps to try to engage patients with some of their behavior. So some of it is around activity, but a lot of it's around medication adherence, where we know we can have a really big impact on patient outcomes. It's really exciting, and we're learning a lot about the use of apps in these patients, and also different behavioral economic principles that might be helpful to help patients care for heart failure. I became interested in heart failure as I went through my training. I always really liked having a really great relationship with patients. And so I really like the idea of being able to care for patients over a long period of time. And heart failure is a chronic disorder where you really get to know your patients and help them through the thick and thin. And then I always loved the physiology. Heart failure is really fascinating, and it's a really exciting time to actually be a heart failure cardiologist, because we have a lot of new therapies, but we don't know how to implement them. And so that's where I spend a lot of my efforts.